I would research it. Most insurance plans don't cover it, but I think it was about $600 or $700 when I was looking at it for myself, which was about 2 years ago. So I think it's something that could conceivably be very beneficial. So I would definitely discuss it with your doctor, because I do think it creates an avenue to help promote healing.
Nice.
Yeah.
Personal experience with that, Chris.
There we go. That's the only reason why I know about it, guys. Sorry. Because I researched it for myself. Let's see. We got lots of watching.
No.
How come there's no questions coming through here when Bob had it up?
I just started.
Oh, okay.
I have a new one.
Let people know you'll talk about any topic regarding pharma.
Yeah, if there's anything that you guys want to know that's pharmaceutically related, feel free to ask questions, and I'll do my best to try and help you out where I can. All right, let's see what we got here. Nuclear muscle, hello. Let's see, anyone vegan?
Yeah.
Well, there's lots of vegan people out there, so I think it's certainly a healthy lifestyle. I mean, as long as you're getting your protein in, so I think it's certainly something that's very effective, and you don't see a lot of people that are unhealthy vegans. So I think it's something that if you can gravitate to and you're getting a good protein source, I think it's a very reasonable lifestyle.
Thank you. All right, people are signing in left and right here.
All right.
What about Proloria injections, good or bad?
Well, I can't. One more time.
Proloria injections. Are you familiar with those?
No, I guess I'm not. That one, I'm sorry. I'm not familiar with Proloria. So
Here's one from Facebook. What is the best kind of turmeric for inflammation?
Well, I think as far as turmeric,
you want to repeat that?
What is the best kind of turmeric for inflammation? I don't think there's necessarily a best. I think you're just going to want to go to a reputable source. So you're going to want something that is repeatable, meaning you go back to it, that's scientifically verified. If it's tested by USP labs, although most of the nutraceuticals are not, but you just want to have a reputable source. It probably should be coupled with black pepper, so that seems to enhance the absorption of it, and so you'll get better anti-inflammatory activity out of your turmeric.
Here's one from Chip. Imetrix for headaches.
Imetrix.
Not familiar.
I'm not sure.
Imetrix.
I'm not familiar with. I don't know if that'd be a European medication or not.
Sure,
so it's hard to say. I mean, one thing that if we get European, South African, some of the medications, they're the same drugs, but they have different names overseas versus the United States. So I'm going to be much more familiar with medications from the U.S.
Sure.
So,
Brad, do you want to let people know this is about pharmacy that we're asking questions today? Sure, right. So Chris is here. He is a pharmacist for 26 years and very knowledgeable, and will help you if you have any questions regarding medications that you're maybe on or you're maybe getting, or your family member. Chris will he'll do an excellent job on informing you. You have more time than talking to the doctor, to the pharmacist at the store, so it'll be very complete.
Yeah, I see one here from Shelley. Shelley is asking the relation between vitamin D and musculoskeletal problems. Yeah, Shelley, that's a really good question. Actually, there seems to be some correlations that, with respect to vitamin D, may help to improve muscle functioning. So I think it's something that would be reasonable to take. Really, we don't need huge doses of vitamin D. So, I mean, I would keep you between 800 IUs to 1,000 IUs, or some people use micrograms, so up to 25 micrograms a day. There are people that take much more, but there we go. Now I'm clean. But sometimes with vitamin D, you don't want to be taking too much. The newer studies are suggesting that higher doses, even beyond 1,000 IUs or 25 micrograms, actually may have a negative effect. So I know that the last time we talked about vitamin D, a lot of people were a little concerned because they take much higher doses. It depends on your physician. It depends on your vitamin D levels. So that would be something you want to work directly with your doctor with, to make sure at least the laboratory values that they take dictate the level of vitamin D dosing that you should be using. But yeah, I think there is a possibility that it will help with muscle functioning, might help with coordination, might help with some pain. Also works with your immune system, works with bone health. Coupling it with probably vitamin K might help to improve the absorption as well. Sure. Obviously, sunlight is how we make it. So if you're somebody that has very fair skin or worried about skin cancer, obviously then we want to use the supplement.
All right. Somebody wants one for a long. Oh, never mind.
Do you have a magic bullet for Jesus is Lord? Happy Easter. Do you have a magic bullet for psoriatic arthritis flares? Honestly, that's a really hard question. I mean, psoriatic arthritis is a rough condition. Not only can it affect your skin, but it can also affect your joints. Typically, the mainstays of therapy, they're going to use immune suppressing or disease modifying drugs, which tend to have an immune response that can weaken your immune system. So it would be something you want to work very closely with your doctor. There's, injectables like Humira are certainly something that has worked very well. Some people have successfully used things like Enbrel. So there are very effective, mostly biologic type medications that are really suited for your condition. But there's several products out there in the biologic category that I would definitely encourage you to talk to your doctor about it. But regardless of a magic bullet, no, I mean, it's a progressive, long-standing disease. That's immune response driven. So if we can get you to go into remission, I think you'll hopefully feel a lot more comfortable depending on the selection of medications that your doctor would choose for you.
Nice.
All right. Do you count another one?
Yeah, fire away.
Okay. Sorry, I lost my space here. Have you heard anything about ivermectin for COVID?
Yeah, ivermectin for COVID. There seems to be some studies out there that suggest that it could be conceivably very effective at treating active COVID cases. It's a small population sampling that they've done the research on. I think there could be some positive effects. I mean, I think, things like dexamethasone are also widely used in hospitalized cases, but at least the small sample size that I saw with ivermectin shows that it could actually seem to help to diminish and get you to heal through the disease pretty quickly.
It's a relatively new one.
Yeah, I mean, ivermectin has been around for years. It's used for parasitic infections. So people use it from lice to scabies.
But new with COVID.
New with COVID,
Okay.
so yes.
Sure.
This is one from Melissa. What can a person take for pain instead of narcotics?
Instead of narcotics. Hi, Melissa. You just asked about what you can use for pain instead of narcotics. There's a variety of different things that you and your doctor can certainly select from. A lot of it comes down to, one, we don't want you on narcotics because they're addictive. So long term, it's never a really good solution. But depending upon liver, kidney, stomach. So I mean, we can use things like Nsaids, so ibuprofen, naproxen. There are several prescription anti-inflammatories. Meloxicam is gentler on the stomach for long term. Acetaminophen or paracetamol would be certainly something that one could consider as well for pain relief. To kind of jump into Brad's world, I think some of the modalities for physical therapy, typically finding pain. I mean, I think ice, stretching, physical therapy activity, exercise in general.
Sometimes a hot pack, and it kind of depends on the situation. Some people, if it's an orthopedic problem like back pain, it's amazing what you can do if lying in bed. Just how you position your body can change your pain level from 5/10 down to a 2/10, just by how you position or do your posture. So when someone talks to me about, or when I hear pain, that's my go-to first, and then I'm thinking, what do I? Yeah. Then the pill box.
And I would agree with Brad. I mean, if there are physical things that you can do with either activity, stretching, positional, I think that those go a long, long way. And oftentimes, I think, at least in the United States, doctors just want to try and they'll evaluate and treat. And it's not that they don't care. It's just that most people want a quick response, and so it's easy to pop a pill versus maybe putting in the work with physical therapy and reconditioning the muscles, working on your posture to make sure you're sitting properly, so that you can get the effectiveness, so that we're not getting the sore neck, the sore back. So, I mean, I think that there are lots of drugs that are non-narcotic that will certainly help. I would also consider things like massage. I would also consider things like acupuncture. I think that there are a lot of different ways that we can treat pain effectively, but a lot of it's very specific to you and what you're willing to work with and put up with.
Very good.
All right, let's see. Kit Samari, what is your opinion on Siraza? Oh gosh, I don't know what Siraza is, so I'm sorry. I've been stumped yet again.
Oh, stumped
again. So, man.
Oh, can you read that, Chris?
I'll try. All right, Christy. My doctor gave me Voltaren for inflammation, which she believes are shin splints. Can you tell me more about it? It doesn't seem to be working. Yeah, shin splints are really painful. So I'm assuming you're probably a runner. There's a lot of things, and I'll probably have Brad jump in a little bit. But my experience with shin splints, I mean, anti-inflammatories like Voltaren gel can be effective, and sometimes you have to schedule it 4 times a day, and probably with your shins I'd probably use about a 2-gram amount, which when you look at that spreading blade that's in the package, you want to do it about every 4 to 6 hours apart. I would tell you that probably more effectively, I think ice in most cases is really effective. I've actually, myself, when I've had bad shin splints, I've actually would take a bag of ice, put cold water in a tub, kneel in it for 5 minutes and come out. And the other exercise that I did, and you can kind of talk about it, but we used to, at track, our coaches would have us like have somebody stand on your feet, and you kind of create resistance to try and strengthen these muscles within the shins.
So the anterior, doing probably an eccentric strengthening exercise, which is kind of hard to explain here.
Yeah.
But, we do have a video on, if you go Google Bob and Brad Shin Splints, I think we have 2 or 3 videos on treatment that are going into detail on that. But again, cold packs, some specific exercises, and you can do foam rolling, or you can actually do some other, if you had a ball for a massage, for self-massage, that works well. Again, it's hard for me to explain, but we do have those videos, and they're usually 5 to 10 minute videos that'll be real clear and demonstrate how the technique is done.
Okay. All right, fire away. All right, let's see. Thanks. Fosamax and Prolia for osteoporosis, pros and cons. Okay, Barbara, excellent question. So Fosamax is easy because it's a tablet you take once a week or daily, but most people do the weekly dose. The risk with Fosamax would be, when you get that jawbone, the necrolysis of the jaw. So if you're a cancer patient or you've had a lot of dental work, you want to maybe talk with your dentist and your physician to see if it's even an adequately safe program for you. But using Fosamax or Lendronate works very effectively. You take it weekly on an empty stomach. Biggest risks are heartburn, so we want to be real careful with that. That's why it's very important to have very good posture if you're sitting. I ideally tell people to take it right away on an empty stomach, 30 to 60 minutes for the first food of the day. Stay upright. So I'd take the medication, go hop in the shower, and do everything that you can do standing. I don't want you hunched over or leaning back or reclining, because actually the drug is very acid sensitive, but it's also can trigger reflux, and we want to be real careful. It's one of the negative effects of things like Lendronate or Fosamax. Prolia is a little bit different. Those are administered by physicians, but it works more in a different response, but it helps to stimulate bone generation. I think it works really well. There's a couple other, there's Forteo, which is similar to it too, that works very effectively. So probably considering vitamin D, making sure you're getting dietary calcium, whether you're vegan or not. I mean, you can get it through plant sources, or you can, get it through, just calcium supplementation. So whatever works better for you.
Sure.
Marilyn, what ointments do you recommend for knee pain? Is lidocaine patch good to use 3 times a week? Okay, Marilyn, that's a pretty good question. Lidocaine is a numbing agent, so it's an anesthetic. So basically, it works topically. So depending upon the type of knee pain that you have, if it's more internal, let's say you've got torn cartilage, you'd probably want to be working with your physician and probably a physical therapist like Brad to make sure that we're addressing the needs properly. Lidocaine 3 times a week, well, I mean, if you're running 3 times a week, you put it on to try and relieve your pain from after running. I think that's okay to give you some relief, but I kind of wonder if
she's talking about just rubbing a topical, rubbing a ointment.
Well, and there's patches too. So
Okay.
lidocaine comes as patches, which I don't know how well that'll stay on your knee, but it's just a superficial numbing. So it might get to like your patella tendon. So I guess it'd be interesting to know what your knee pain was directly. My bigger concern is if you're having constant knee pain, if there's a bigger issue that somebody like this guy here could probably, based on the needs of your problem, maybe there's some more things, stretching, strengthening, that might be more effective.
Yeah, when you just say knee pain, there's so many sources that could cause the pain between your, infrapatellar tendon. It could be a meniscus problem. It could be a irritated sore ligament. There's just it's just hard to say, but if you can avoid doing things that irritate it, just go right down to the basics. Stop doing that. Check your range of motion. We've got a lot of videos on knee pain and how to self-assess for different diagnoses that you can do. Just Google Bob and Brad knee pain, and you'll see a number of videos that will come up and go through a nice 10-minute or so explanation, details, self-diagnosis, and treatment to get you going in the right direction. So yeah, that's if you could have just narrowed it down a little bit. It was on the kneecap or the back.
But I will say too, though, that with respect to lidocaine, I mean, I think it's a good numbing agent, but it doesn't penetrate deeply. So I think that's one of the problems. I mean, I would probably be a bigger fan of ice. and maybe even heat, alternative heat too,
Sure.
because we can get some circulation to the area as well. But those are some of my personal experience, and mostly because I train with Brad half the time, that I learned that from him.
I got one from BC.
All right, BC.
Was put on 10 milligrams of lisinopril
Okay.
last month for hypertension. Initially, it brought down, but now it's creeping back up. Any thoughts on this, or should I ask the doctor to up the dose?
Definitely. All right. So BC was asking about being placed on lisinopril for blood
Right.
pressure, about a 10 milligram dose. Started working well initially and has now kind of started seeing that blood pressure creep up. So I think, yeah, it's definitely something you want to get your doctor involved with. A couple of things that non-drug that I would consider. How's your activity level? Are you getting 5 days a week of 30 minutes of cardiovascular activity, at least like a brisk walk? Avoiding salt in your diets would be a couple of things, just your exercise level in general. If those are things that you can already check off and you're seeing this kind of elevate, I guess I'd be wondering if there's some genetic conditions, see if there's any other family members that might have conditions with hypertension as well. But I think that, 10 milligrams is a very, 5 milligrams, well, actually 2.5 milligrams is the lowest dose of lisinopril. So you're kind of middle of the road. I think it'd be reasonable to consider an increase, but make sure that anytime anybody's being treated for hypertension, no matter what drug or drugs that you may be using to treat hypertension, our pillars of health are going to be making sure you're exercising, making sure you're eating well, and making sure you're getting plenty of rest. So we want to make sure that those are being adhered to very strongly. They're actually probably maybe even more important than what the drugs can actually do for us. So we'll be real careful with that.
I just want to mention, I know I had an experience with high blood pressure readings, and I was at home taking them. I ended up going in, it's a long story, but I went in and it ended up being my blood pressure device was inaccurate.
Sure.
So that's a possibility, but it sounds like it was creeping up, maybe not.
Yeah, I guess, yeah. And I mean, whatever device you use, make sure it's, if you're going to do home testing, you might even want to have it calibrated with your doctor's sphygmometer, they use at the office. So sometimes, it can be like plus or minus 5 points either way, top and bottom, or systolic and diastolic numbers. So I would encourage that just so you have consistency of your measurements, but work closely with the physician on that one, because anything that we can do to keep that blood pressure in check is going to have much more long-term value for you to keep you safe and healthy.
Perfect.
Let's see what we got here. Evelyn, can you take too many supplements, vitamins? Yes, Evelyn, you can absolutely take way too many supplements. I mean, I'm a firm believer that eating is the best way to get your supplements. So you want to have a well-balanced diet, but most Americans live a very, very, very busy lifestyle, and it's almost impossible to try and eat the exact amount of foods that we're supposed to be eating to get the right kind of nutrients. So what do we try and do in its place? It's taking supplements. But, sometimes taking, a lot of the medication, or actually the vitamins that are available can be too hypercharged or have too many ingredients in there where you're, between your daily diet and then too strong of a vitamin might be giving you too many nutrients that you actually don't need. In many cases, if it's a water-soluble vitamin, we'll just pick on the B vitamins. You're going to excrete it anyways. So we want to make sure that you're taking the right amount for what you need. I would, realistically, if you're concerned about your nutritional levels, see a nutritionist. I think that a lot of times, or work with your physician, get a blood level, and just see where some of these things are. But a lot of times, nutritionists deal with that pretty exclusively.
Sure.
And so you can kind of see where what your life goals are. I mean, it's going to come down to, getting your protein, getting your veggies, getting your fruits. One of the favorite things I like to say, don't eat anything in a box. But, I think supplementation of like a general multivitamin is fine. Some people will take a little bit more of, just your exogenous vitamins. Some people will maybe take folate for certain reasons. Some people will take B1 for certain reasons. Some people will take B2, like for migraine prevention, magnesium. So there's a lot of things that you can do therapeutically that's relevant, but you don't want to overdo on any of those doses, because too much of anything can be bad.
From my personal experience, because I'm not a nutritionist, my knowledge on this is not real good, but I've got a couple of books. I've read those and just talking to people. But at least when you have a book, or just go online and get a reference to what kind of vegetables have vitamin D or B or whatever it may be. And it's a lot of it just self-education and going to the store and shop wisely. And it's an educational process.
Well, and the other thing is go see your local pharmacist. They'll be familiar with what your profile is, what other medications you may be taking, what your health conditions are, and have a frank and honest discussion about your goals nutritionally to see what we can do better for you, what you can do in your daily diet, and what you can do with your daily activity level. All right, let's see. Shirley, can I take something other than thioxine for underactive? So thioxine, I'm guessing, is probably the same as levothyroxine. Thioxine is not used in the United States, but I'm going to guess it's levothyroxine. There are also natural thyroid desiccated, like Armor Thyroid would be a brand, or NP Thyroid or Nature Thyroid. So those use kind of a blend of L3 and L4, or T3 and T4 insofar as thyroid hormone. They use desiccated pig, so it's more natural. Otherwise, people take like L-thyrionine with levothyroxine to try and create a synthetic version of that. Thyroid conditions are lifelong, so your doctor will be taking annual blood work. I mean, there's no curative thing for a thyroid at this point. So if it's underactive, you're probably going to need the medication to stimulate that forever. We just haven't found a way to replace that gland and make sure it's firing on all cylinders. We've seen some people try iodine, but the studies haven't proven out to make it all that effective for a underactive thyroid treatment. Some people have had some success, but more often than not, it's going to come down to taking a thyroid medication. Thioxine is just something I'm not familiar with, but I'm assuming it's the same as levothyroxine, which is what most people use in the States.
This is from William. He's been taking 800 milligrams to 1,600 milligrams of ibuprofen for 20 years every day. Is there side effects to look for?
Yeah, William, good question about 800 to 1,600 milligrams of ibuprofen daily. Long term, that can be rough on your kidneys, which can be rough on your heart. Can also cause GI side effects like stomach ulceration. So long-term NSAIDs, while used frequently by many, many people, I've joked with Brad over the years that people call it vitamin I because it's so easy and prevalent to take, and it works very effectively for a lot of people. But long-term, we do have to be careful with it because it can really mess up your kidneys. It can really mess up, and as a result of your kidneys, it can cause heart issues. So we want to be careful with that. And also have to be careful of our GI tract, our stomach. So stomach ulceration is a very real issue, the way that NSAIDs like ibuprofen work. And it wouldn't be just ibuprofen. It could be naproxen, it could be ibuprofen, it could be any of the prescription NSAIDs. They do reduce the amount of prostaglandins that are produced in your body, and that's what makes the greasy mucus coating of your stomach lining. And so when we inhibit that, there's a higher increase for stomach ulceration. So long-term, and particularly as we age, that becomes a more prevalent and higher risk.
So are there any, I'm sorry to jump in, but for William, is there any symptoms he can be looking for as far as the stomach or with his kidneys? I mean, most people don't know their kidneys are going bad, or are there symptoms?
And that's part of the problem is, heart issues associated with anything, whether it's NSAID or not, it's also kind of silent issue. And same with your kidneys. They
don't the heart issues you said come from the kidney?
Probably from the kidney. But so, I mean, sometimes, if you have a kidney infection, you have low back pain, and this gets to be a little bit out of my level of expertise, but one way or the other, make sure your doctor's on board with you doing that. I would say long-term, and you've said you've taken it for almost 2 decades. So I would be careful with that long-term. I would look to see if there's other things you can try, maybe ice. Depending upon, whether there's an activity thing, like ice after work. I like ice massage if it's, an elbow or a joint, because it only takes 5 minutes to do it. But you don't want to go much longer than that because you can frostbite the skin.
Well, there's ways to avoid that. You have to look at our video.
Yeah. All right. Or you can watch Bob and Brad's
You're always
videos.
going things that Chris is going very aggressive with his cold. But, now you can use, there's more studies coming out, or, it might be a warm pad. Yep. That alleviates the pain, so you can get off of that. Again, it's always extinguish the easy route, the routes that don't take internal, medications.
So I would say, I take ibuprofen almost daily myself. I try to avoid it when I can, but I'm not very smart with the training regimen that I do, so I use ibuprofen.
He's more aggressive than most people.
So I would say just make sure your doctor's on board and stay well hydrated too. So hopefully that helps. All right, Mika. Let's see. Costochondritis is affecting everyday life. What you recommend for medication? You have psoriatic.
Oh,
okay. Well,
I've got that.
Okay, well, NSAIDs are kind of going to be the mainstay from what you can do from an over-the-counter perspective. I think that some of the things that, and Brad will probably have a little trick for you, because I know you just
you can finish your
you can so
offer.
I would just tell, I mean, like things like ibuprofen or Aleve, which is naproxen sodium, I think are a good starting point. But I think Brad is going to have a couple of, I mean, it'll at least alleviate some of the pain that you're experiencing, but probably not all of it. It can be, I guess, would you call it a chronic condition?
Well, costochondritis, I have it. I went into the emergency 3 times with chest pain. Each time they said your heart is fine. It's where the cartilage meets the sternum. I don't know if you're watching this or not, but there's a product. Bob, what's the name of Steve August? Yeah. There's a therapist, Steve August. He has a video on it. I highly recommend that you watch it. It's a longer one. He's got 3 or 4 videos specifically on it. It made a huge difference in my life. He has a product called a back pod that he invented. As a matter of fact, I was just using it before we videoed today because I was getting some costochondritis pain. It works very well. We can't go through it now, but we have videos on costochondritis. Google Bob and Brad as well. We'll show you how I use this. I've been using it for about 2 years, and I have very good pain management and almost abolished the symptoms. Not totally. I still need to do it consistently. So there's no medications needed with it. Steve August is just, he actually gives talks to doctors about it. I would have to say, probably a world leader in that particular diagnosis.
Wow.
So
there you go.
I hope that's
that'll help. Yeah.
There you go.
All right. Let's see. We got Geekus World. What are your thoughts on flecainide and metoprolol? Flecainide is probably something that we don't use in the United States. Metoprolol is a beta blocker, so I'm assuming that you might have probably some arrhythmia issues. So, I mean, there's flecainide, which would be something probably similar to that. So the combination and the beta blocker, the metoprolol, helps to kind of work on the intrinsic action of the heart to kind of control the beat, and it kind of slows down the adrenal system. It also relaxes the blood vessels, so it brings down blood pressure as well. And then the antiarrhythmic helps to kind of keep that sinus, that sinus activity, so you're getting a more consistent beat rather than kind of that rapid arrhythmia. So the combination, though, can be rough on the liver. You want to make sure that your doctor is monitoring that very closely. I'm just going by class because I think it's going to be most similar to like flecamide or meloxicam. So we do want to be real careful with those things. But usually when you're on a combination of drugs like that, your doctor is monitoring you very, very closely.
I got a question.
Okay.
This is Neelam.
Neelam?
Yeah.
Hey, Neelam.
And he's from India.
From India.
What are the best diuretics to get rid of water retention due to PCOS, which is polycystic ovarian syndrome?
Okay.
I didn't know that was.
Yeah, it's polycystic ovarian syndrome. It's very painful.
Maybe you better repeat the question.
Okay, so what kind of diuretics are best to treat polycystic ovarian syndrome? It's pretty painful, from my understanding. So it's very uncomfortable. Diuretics will help with fluid retention. Is there really one that's best? I mean, all diuretics, they serve a purpose. They help your body relieve fluid. So whether it's hydrochlorothiazide, furosemide, I mean, there's several of them out there, and I'm not sure what's available directly in India. So I don't know if you use the same ones or if they'll be the same names as what's in the United States. I wouldn't say that there's a best diuretic. It's going to be the best one for you. So your doctor needs to monitor your electrolyte levels because we're using a diuretic, whether it's for hypertension or fluid retention. It's certainly something that could make you lose potassium and sodium, so we have to be careful with that. So there's potassium-sparing diuretics, there's loop diuretics, there's thiazide diuretics. So there's many different versions of those, and so it comes down to what you're going to tolerate, side effects, and what they're going to be doing for your body, and the length of time that you may need to use it. So with what you're describing is a chronic condition. So I would work closely with your doctor to see if there's one special one that you could take that might be best for you, and making sure they're monitoring your lab values so that we can keep you safe. All right, CBD. Is CBD a good alternative to pain medications? That's a question from Keisha. Yeah, Keisha, I think that it can be something to be put on the table for sure for helping with pain relief. I think CBD is being researched like crazy because of the way that it works in our system. We have a cannabinoid system naturally, and so it works on those receptors, and I think it really does help with those nociceptors or pain receptors, and I think it has its place in medicine. There is not enough wide bodies of research done yet on this. It does have some risks as far as with your liver and certain medications like blood thinners. So you have to be careful if you're on anything like that. But I do think it has its place. I would definitely make sure your doctor's in tune with this based on, if there's any medications that you're using. Talk to your local pharmacist and see what they think that's appropriate for you. But I do think there's an avenue for it, for sure.
Next.
All right.
No answer.
All right. So Stig Design 1. Hey, Chris, what other kind of medication that are in Europe that might be better for pain other than tramadol? I use Noblegun, retard 300 milligram per day. I don't like to use it. I guess I don't know what Noblegun retard is, so I'm not familiar with that. I'm sorry, Stig. Tramadol is a low-grade narcotic. That's, I guess, it'd be interesting to know what kind of pain that you're experiencing. So yeah, it's a little too general of a question. I mean, there are other narcotics that are available, but I don't like that as a solution. You can maybe, depending upon what you have going on, you talked about Nsaids. I don't know if you guys use things like acetaminophen or paracetamol. Obviously, ice, depending on, it really depends on what your pain is. So it's kind of hard for me to get something more general. If you can be a little bit more specific, I would certainly try and touch on it to see if there's something a little bit better for you.
Yeah, I think so. Obviously, we can bring up the point that whether you're calling from the States or like we got India, Europe, there's there's different medication. Is it subgroups or just what, like our FDA kind of controls? They have their own.
Yeah, every country is going to have their own governing body as far as prescriptions. In the United States, the FDA kind of governs ours. A lot of the medications are shared, and so even in Canada, they just have different names than what we have in the United States.
Okay.
So, so over in the UK, I mean, there's and obviously things like Norway, India, Africa, South Africa. I mean, there could be similar drug products, similar chemicals, similar drug classes.
Yeah,
but at some point or another, whatever you have for pain, I guess, it'll just kind of depend.
Sure.
And I would work with your doctor. Let them know you're not satisfied. I mean, speak up. Please let them know. I mean, they're there to try and help you live a better, healthier life. Maybe seek out if it's something that's for physical or mechanical. Maybe physical therapy is something that's in your avenue that we can hopefully strengthen and maybe correct some of the issues that are causing it. So if it's something more like cancer, I mean, if you can give me some more specifics, I can try and touch on it a little bit more effectively.
Bob?
I don't know if you know this one. Janice.
Hey, Janice.
Topamax has an appetite
suppressant. Yes.
Good or bad?
Actually, topiramate, Topamax is a natural. It suppresses your appetite. Topiramate or Topamax is widely been used initially as a seizure-reducing medication. Most often in my world, we see it more for migraine prevention now. So and in other neurologic pain. It's still very good as a seizure medication. We do see it combined with other medications like bupropion to actually act as an anorectic or something to suppress appetite. So I think it has its place. Topiramate or Topamax does have a tendency to make you tired. One of the nicknames that when Topamax came out many years ago, Topamax equals Dopamax. It makes you kind of dopey, makes you a little cloudy. It's a drug that sometimes, we want to walk you up slowly so that it's not affecting you cognitively. We want you to be able to think clearly while you're on it. So a slow titration is certainly something that would be effective. And if or when you're ready to go off it, you probably want to step off of it slowly too, so you don't have any withdrawal effects.
So that's strictly prescription.
That is a prescription
no
drug. And you'd want to work with your doctor with that specifically for weight loss. But I think that it does have an avenue. We've seen, and basically they just kind of learned it because people were treating migraines and seizures were losing weight simply because they didn't eat. So the drug itself does work. Oh, look at the table. This is exciting. All right, so we got live action. But I think it's something that you could talk to your doctor about and see if they feel that it's something would be safe and effective for you.
Yep.
Another one from Tanner.
All right, for Natty. All right, Schwango complex for adrenal complex. Does it help during physical therapy?
So she's taking therapy and she's wondering if. Are you familiar with that term?
Ashwagandha is a complex. It's a herbal type product that it's used for pain relief.
Okay.
I don't know what adrenal complex is, but I'm assuming it's got ashwagandha in there. It's not something I'm widely familiar with.
Ashwagandha, is that a pill or a tea?
I think it's an extract.
Okay, extract.
I think it comes from a root, but I'm not 100% certain.
Okay.
Unfortunately, you've stumped me, but so it's going to happen.
Yeah.
So sorry, guys. Eric, all right, from Florida. Can vaccines and/or frequency given affect your tendons, flexibility, and motor skills? Not that Eric, I don't think so. Vaccines, by most intents and purposes, are going to prevent disease state, but they generally will not create tendonitis or anything else from that, or even motor symptoms. People can have unusual side effects to just about anything we put in your body, whether it's a drug or a vaccine. Most common when we give a vaccine, we warn people that it's going to cause an immune response because we usually place it in the deltoid here. And so the one thing that we want to be real careful with is that it's placed properly. So usually what I target for is if you move your arm like this, you can actually feel your deltoid process fire.
Sure.
So this is our target. So you want to be, otherwise some people tell you it's 3 fingers below your shoulder, so which kind of comes right down right in here.
Yep.
So that's where we want to hit. If they give you a shot higher up, there are nerves there that could cause some pain. We've actually had case studies where people get the injection in the wrong spot, and all of a sudden they do have nerve pain and damage. So it's very important to place the vaccine in the right spot. So it's something that I'm very cognizant of because I certainly don't want to hurt anybody. I'm here to try and help. But insofar as tendons, no, it should not be creating tendonitis. I mean, if it caused an immune response that caused your immune system to get hypercharged, maybe it would be a very limited effect that is certainly not common. I would tell you to use something like ibuprofen or acetaminophen to try and calm it down. I would probably actually talk to the individual that gave you the vaccine. I would report it on the VAERS network, so the Vaccine Adverse Event Reporting System. I think that would be something that would be beneficial to the manufacturer that had that vaccine so they could research it and see what we could do. So the CDC is very proactive as far as trying to learn that, even if it's been something like MMR, which has been around forever. So I would maybe look into that if you've got kind of an acute response after a vaccination that caused you to feel like you had tendonitis. It's usually pretty short term, if anything, and a lot of it's due to the immune response that it's creating so that we can protect your body from the disease you're trying to be protected from.
That was Eric from Florida, right?
Yes.
Yeah. Say hi to my daughter. She just got down here this morning. She's on a little vacation. Just relax with the table. My God.
From Anita.
Hey, Anita.
Can you talk about memory and cognitive enhancements? Are all pills for this worthless?
Anita, great question, and the answer is yes. So you were wondering if there's medications over the counter that be used for cognitive enhancement. I just actually read a study out of Medscape that suggests that a lot of these things are pretty much, if it's no better than placebo, which is just a sugar pill. So, which is unfortunate because I think a lot of people are trying to gravitate towards ways to help to try and improve their memories. I mean, I would tell you that if you're going to try anything, caffeine is probably the simplest and easiest one. Have a cup of coffee. That will keep you at least more alert temporarily. But keep in mind when you use coffee on a regular basis, you develop a tolerance to it. Some people have tried ginkgo and ginkgo biloba. Some people find that can be something that kind of keeps you awake, but it hasn't proven to be any more effective than a cup of coffee. What I would tell you is that to play brain games, I would actually probably eschew the pharmaceuticals and vitamin supplements. And
my wife does that sometimes. Brain games.
Yeah.
I'm just kidding.
No, that's a whole different discussion.
You're talking about crossword puzzles?
So do something that's stimulating. Whether it's playing cards with, you can play chess, you can play cards. If you have a smartphone, there's a number of brain games that you can play that will help to stimulate those cognitive pathways. And I think, even doing something spatially oriented like a jigsaw puzzle, doing models, painting, anything you can do that's stimulating is going to help you with that memory and cognitive functioning. When you say if you don't use it, you're going to lose it, that is true for so many different things. So I would encourage you to just keep seeking out brain activities that keep you stimulated. I just really don't believe that there's no prescriptions really going to do anything. But most likely, insofar as the over-the-counter supplements available, they just really haven't proven to be their weight in gold.
Right. Oh, here we got another one from Tanner. All right. Linda.
All right.
Ooh. Oh, it shrunk. It's right there.
Yeah, let me see if I can
there
Linda,
we go.
All right. What are your thoughts on Costochondritis for ankylosing spondylitis? You're starting this soon. Okay, how can I boost
We have a lot of questions on.
All right, Costochondritis for ankle. Yeah, I think that I think Cosentyx is certainly something that would work well for
Wait,
you.
we better pronounce what the diagnosis is.
Ankylosing spondylitis.
Right.
So yeah,
Things are getting tight and stiff with pain.
very painful condition. I'm sorry that you have to deal with that. Using the biologics, I think, are certainly something that can provide relief. It's a progressive disease that does tend to get worse. Whether it's, using physical therapy to help to kind of strengthen some of the core muscles and things around it, or whatever you're even able to do.
Yeah, there may be some range of motion. Yeah, it may vary depending on the specifics.
Because that can, like I said, get progressively worse as far as, but you're worried because it can weaken your immune system and make you more prone to things like COVID, flu, pneumonia. So, getting your vaccine will be the first thing that I would tell you to do against flu, pneumonia, and obviously COVID. And then obviously it's going to be hand washing and distancing would be certainly something so if you have a family member or friend that's sick, don't visit them. But it's going to be your hand washing, eating well. Immune boosting foods are going to be your antioxidants. One of Brad's favorite things is grapefruit. So if you're not on any medications that affect your liver, like a statin, I think that would be something, and there's really only 3 of them that cause the problem. But, I think that would be something. There's, anything that you can get through fruits and veggies that are antioxidant in nature will help to stimulate your immune system. So that's going to be, mostly your citrusy type fruits. But I think that that's certainly something naturally that you can do. There's not a lot of supplements that are going to really bolster it, but other than vaccination. But hopefully that'll be something helping. And good luck with that. Ankylosing spondylitis, some tough stuff. I'll try. Allie, does eating an excessive amount of zinc affect the body?
Wait, Allie, you think that her first and last name? They got the same name?
I think it's Ollie.
Oh,
Maybe
Ollie. I'm sorry.
Well, I'm not sure, but either way,
So what's the question?
I'm wondering if zinc, you can overdo it on zinc, is basically what they're wondering. And yes, you can. Too much zinc can actually be a bad thing. So not good for the kidneys long term.
So we're talking supplements.
Yeah. And so, if you're going to do a supplement, I really wouldn't take much more than probably 50 milligrams a day. Some people take 220 milligrams of zinc sulfate, which would be like 1 a day. But I wouldn't take it long term unless your doctor feels that it's necessary for you and your immune functioning. Zinc is a known immune modifier. The studies have not really proven that even vitamin C, zinc, and D have been all that effective at treating COVID directly, if that's maybe the nature of your question. But low levels, I don't think are going to hurt you. I would tell you to try and get it through your diet, but it's an element that's a trace amount, so you're going to get through your plant-based food. So greens,
green leaves, yeah.
Greens, you can get it through your diet from meat too. Meaty sources, fish. So
Sure.
You can get zinc that way as well. I would tell you to get it through natural sources if you can. If you're deficient, then you would go with your doctor's recommendations, which usually is going to be about 50 milligrams per day.
Okay.
All right.
Next.
This is Crystal.
Hey, Crystal.
Oh, sorry. Never mind. Crystal.
Oh,
Crystal, you're never minding her?
How about Paul?
Hey, Paul.
Okay.
What do you think of creatinine?
Okay.
I've been taking it for years.
Ooh. All right, Paul. Yeah, I've got some thoughts on creatinine. Creatinine is used for a lot of bodybuilders and athletes use it. It helps.
Prescription?
No, it's over the counter. It's you'll see that in your bodybuilding type magazines.
Okay.
People use that to help to try and stimulate muscle growth and strength. Interesting when you do the hardcore science. You might get about an 8% improvement in that, but for 8%, unless you are in the upper 1% where you're a pro athlete, it's actually a banned substance by the NFL and the IOC. Long term, it can be damaging to your kidneys. So if it sounds like you've used it for many, many years. I would make sure that you're hydrating well. I'm assuming you are if you've been getting away with it. I just don't know that long term it's really something that's safe or effective. I would tell you to get, if you're looking to try and recover faster so that you can get bigger gains and stay, getting the size that you want, or recovering faster so that you can attack your next workout. I'm going to tell you to hydrate like crazy and get protein through things like eggs and fish and lean poultry, those types of things. I think your diet, or in a lot of cases, are much better.
Did you mention any long-term side effects?
Long-term effects of the creatine or creatinine or creatine, it'll kill your kidneys. So long-term, I'm not a fan. The NFL, the Tampa Bay Buccaneers were the first team to actually ban it, and they would fine their players for using it. So this is probably about 10, 15 years ago. So
Okay.
I would tell you that it was definitely a phase in the late 90s and early 2000s. I just don't think that it really is. I don't think the juice is worth the squeeze, to be honest with you. For anything better to say.
Chris has a way with words that I can always relate to.
All right, Julia. All right, is there anything to take along with iron supplements to help anemia? Yeah, other than more beef and cast iron cooking. I love beef, though, Julia. Okay,
I like cast iron cooking. So
there you go. I'm right there with you. I just like to eat, so that's why I'm kind of a fat guy. But at any rate, that said, yeah, Julia, if you're anemic, there's a couple of different things that you can do. I would always tell you to take a vitamin C supplement, either through natural sources like oranges or citrusy fruit.
Why the C?
Vitamin C enhances the absorption of the iron in the body.
Okay,
so
sure.
that's why. So you would take that preemptively, or as you're, a lot of times we'll tell people to take their iron supplement with a glass of orange juice. I would tell you to eat an orange because there's a ton of sugar in orange juice. You don't need all that extra sugar, but sometimes apple juice is fortified with C too. But again, there's a lot of sugar in those things. So I would tell you to eat a citrusy fruit because I think you're going to get plenty of vitamin C to help to enhance the absorption of the iron, which hopefully will help to bring up your hemoglobin, which will help to minimize your anemia. Depending on the type of anemia, you could even talk to your doctor to see if a B12 supplement is appropriate for you. So things like pernicious anemia, B12 is certainly something. Cyanocobalamin is something that may be beneficial. Some people receive a shot monthly to help with that, and some people do take oral supplements. So anywhere from like 500 micrograms to 1,000 micrograms a day. So those would be things you could definitely discuss with your doctor, your pharmacist, and see if it's appropriate for you. Good question.
Do you know if cast iron cooking, if some of the iron from the skillet does get to the food? I've heard that. But
I think it's trace amounts that I don't think you're going to gain any hard advantage from.
Unless you take a 4-inch grinder.
If you're grinding it, and I would say then, you might become magnetized.
I'm sure I got to put a little of my sick humor in this.
So I think beef actually is a natural source of iron, but you can get it through other meats too. So like fish is a healthy source. So it just kind of depends on your diet in general. You can also get it through other foods as well. Dark leafy green vegetables. So there's other avenues to it, but usually most people, if you're anemic, probably are going to use an iron supplement. But yeah, couple it with vitamin C, and that will enhance the absorption.
Oh, here comes another one from Mike.
All right, RMK22 Senior. I cannot take anti-inflammatory medications. You had a total knee replacement. Is there something else that I can use?
Is this for pain, I'm assuming?
Yeah, I'm assuming. Yeah, he's got to be talking about pain. So I'm sure that whether it's kidney, blood pressure, stomach, there's probably a lot of reasons why you can't. I guess with the total knee, I think we'll probably defer a lot of this to Brad, but as far as maybe acetaminophen to give you a little bit of relief, ice, and then I think probably at this point,
your cold packs are just what we typically use. I have used hot packs with total knees, but not in the first phase. It was actually probably 3 or 4 weeks afterwards. There was still some swelling. The incision was healed. The acute phase was over, and hot pack worked really well on one patient. I usually start people with a cold pack. We do have some details on how to treat pain with total knee replacements. If you Google Bob and Brad total knee replacement, we should have a few videos that come up with some details. But 15 minutes of a cold compress without putting it directly on your skin, so you don't get any frostbite things. And typically they tell you about this after your surgery when you leave the hospital, but a little refresher. And then positioning of it can make a big difference as well. We have something called the leg, what do we call it?
Wedge.
The leg wedge. Yeah, that I've had people so much more comfortable lying down with a leg wedge, which is a specific shape. Where we don't have it here anyways, but that is something that we talk about in our videos as well. Sorry, I wish I could be more specific.
All right, that one from Marcelo.
Hey, Marcelo.
Is testosterone harmful? What are its side effects?
Yeah, good question. Is testosterone harmful? What are its side effects? Actually, yeah, it's actually a very good question. And the answer is yes and no. I'm not a fan of the over-the-counter stimulant testosterone boosters, because I think if you need to be on testosterone, your doctor should be monitoring, meaning you should have the condition low T. When we take too much testosterone, people will use it anabolically to develop big, strong, huge muscles. And some people will use it to recover to get big, strong, huge muscles. But one of the things that we have a problem when we're taking steroids, specifically testosterone, is that it can have problems with your liver, it can have problems with your heart. So we do need to use this judiciously. I think there's a physiological level. Male patients, just like female patients, females go through menopause through the males, our testosterone levels do diminish after about the age of 65. If you're a younger man, I think that, if you're having problems, I would talk to your doctor. They should do blood work to make sure that if it is going to be supplemented, it's doing it at an appropriate amount, because we don't want to cause negative consequences down the road. Taking steroids long term also have some cancer risks, specifically prostate cancer. So it's something that we want to be real mindful of and careful with, because it does have risks. So want to be real careful with that decision.
Here we go. Tanner, Lisa.
Hey, Lisa, is diclofenac okay to take for pain from spondy? Yeah, I mean, I think, hey, Lisa, that's a good question. So that's an anti-inflammatory. That's probably ankylosing spondylitis. Would be my guess.
Yep. Could you pronounce that again?
Diclofenac.
Okay.
So that's an NSAID, or an anti-inflammatory, otherwise known as Voltaren, or some cataflam.
I got some input when you get done.
Okay, so insofar as for pain relief, it is an anti-inflammatory that I think could be used. I mean, long term, we want to be careful with our stomach, we want to be careful with our kidneys, we want to be careful with our hearts. Diclofenac, in some cases, has been kind of warned as one of those drugs that we have to be careful with our cardiovascular system because of the effects on the kidneys that can relate to the heart. So we do want to be careful with that long term. Just work with your doctor. I mean, I think there's other NSAIDs that might, like meloxicam. I mean, diclofenac is pretty cool because it's a good painkiller. So that's why people like it very well. But we do have to be careful and judicious with its use. So any of the NSAIDs are going to fall under that umbrella. But I think Brad's going to interject a little bit for pain relief.
We don't know for sure, but you said spondy. So if it happens to be spondylolisthesis, I have grade 2 spondylolisthesis. I've been diagnosed with it. X-rays about 10 years now. If you go to bobandbrad.com and put in spondylolisthesis, I've got a number of videos. I don't take any pain meds. I rarely take ibuprofen. My pain is well under control, and I'm quite active considering, even people that are not spondy my age.
Yeah.
So anyways, there are alternatives through therapy that you can pursue and be very effective with.
You guys, I'm sorry.
Oh.
Do you want to finish up? Do you want to mention that was it for questions, but we're going to have Jordan coming on at 12:30.
Oh, okay. Sure. Yeah.
All right.
So we're just about ready to wrap it up. We've got other things to do and maybe get something to eat. But we do have another guest coming on, Jordan, and she's going to talk
about nutrition.
She'll
be excellent.
She'll take questions.
Yeah. We're going to go for an hour with that, right? So she's going to, talk back and forth just like this, and there's a really good source.
She knows way more about nutrition than I do, guys. She's an excellent resource.
She is passionate about it, and I'm looking forward to see this because it's the first time with her, right?
Right.
Yeah, and she does our video with her fitness exercise, and great response to people with her. You're going to love her. So enjoy that, and we'll see you there.
All right, thanks, guys. Have a great day.
Hurry up, cut it off.
Trying.
And hold.
There we go.
That was on there.